Today we're going to talk about the different types of sinus rhythms, as well as introduce cardiac events that are important to understand in EKG rhythm interpretation. Sinus rhythms are electrical impulses that originate in the SA node. We can identify that by a P wave, a temporary pause of 3 to 5 small squares before a narrow QRS complex. Now, in 3-lead interpretation, we do not worry about the T wave. That is only important in a 12-lead interpretation. Now, today we're going to be talking about sinus variations in rate, rhythm, as well as event. Normal sinus rhythm is 60 to 100 beats per minute. A sinus rhythm less than 60 is called sinus bradycardia. If the rate is between 100 and 150, we call it sinus tachycardia. We know it is sinus because we can identify P waves. The P wave to the QRS complex is 3 to 5 small blocks. The QRS complex is narrow, and the T waves don't matter. We also look to see the rhythm, and as you can tell in both EKG strips, the pattern is regular. That doesn't always occur. You can have sinus arrhythmia where the pattern varies slightly, and this could be caused by things like respiration, where you can see the pattern alter based on the depth and quality of the patient's breathing. The cardiac events I want to talk about will change the rhythm or break the cadence of your EKG, and it will make your beats appear late, missing, or early. If they are late, we call that a pause, and a prolonged pause is called an arrest. A missing cardiac event is called an exit block, and an early block, or a early beat, is called a premature contraction. And by studying the EKG rhythm strip, we can identify if it came from the atria, we call it a PAC. If it comes from the AV junction, we call it a PJC. And if it comes from the ventricles, we call that a PVC. Late and offbeat. That would be your pause. If you look at the EKG at the bottom, the beat should occur here, however, it missed the beat. And when it did reset the cadence, it set it at a delay, so it does not match the previous beat. Now that can occur quickly. That pause could be quick, or it can be prolonged. If it is a lengthy pause, we call it an arrest. A missing beat that returns in the normal cadence is called an exit block. Now let's look at the underlying rhythm and ask our salient features. Is there a P wave? Yes. Is a P wave where it should be, 3 to 5 small blocks from the QRS complex? Yes. QRS complex is narrow. That's good. Well, what's a rate? Well, we can measure from P to P interval and count 19 small blocks. We can take the number 1500 and divide it by 19, and our heart rate is 78.9 beats per minute. But the rhythm is not 100% equal. We have an entire missing PQRST series that has exited, that is not available. So we call this rhythm a normal sinus rhythm with an SA exit block. What if the beat comes early? Well, if the beat comes early, we can look at that complex and identify where the impulse originated from. So look at the strip on the left. Do you see the regularity of the QRS complexes? Can you identify which one is coming earlier than where it should? The correct answer is this one right here. So let's ask our questions. Is there a P wave present? Yes, there are P waves present for each and every QRS complex. Is the P wave where it should be? 3 to 5 small blocks? Yes, it is. Is the QRS complex narrow? Yes. Well, we have our PQRS. What about our T wave? Wait a minute, there are no T waves. That's okay, it doesn't matter because this is 3-lead interpretation. Since we know that there is a P wave and it's in its proper place, we know that the originating impulse comes from the atria, so we call it a premature atrial contraction. Now let's look at the one on the left. The one on the right. Identify the premature beat. Which one comes earlier than it should? I hope you identified this one right here. Well, let's look to the left. Is there a P wave? Well, no, actually there is not a clear P wave before it. And if that's the case, let's look at the QRS complex. Is it wide or narrow? Well, it's narrow. We know that since there is not a P wave, it did not come from the atria. QRS complex is narrow, so we know it's not in the ventricles. That means that the impulse originated from the AV junction. So we call this a premature junctional contraction. Now this is a PVC. Our strip underneath is a normal sinus rhythm, but if you look at the arrow, there is a wide and bizarre looking complex that is greater than 0.12 seconds, greater than 3 small boxes. This is a PVC. The reason why is because electrical impulse starts in the ventricles and it spreads that impulse across the ventricles cell by cell, and it takes time, causing a wide QRS complex. Now, some terminology you might hear is the word ectopy. So you'll hear people saying normal sinus rhythm with ectopy. That just means an unusual finding. And you'll hear this word foci. So you'll hear unifocal or multifocal. Well, this is an example of a normal sinus rhythm with ectopy. And the ectopy is unifocal PVCs. I have a normal sinus rhythm as my underlying rhythm. However, the arrows are pointing at the PVCs. They share the same shape or morphology. That means that the electrical impulse is starting in the same place and traveling in the same direction. It is a unifocal PVC. In contrast, I have a normal sinus rhythm here. However, this PVC does not look like this PVC. That means I have 2 or more locations that are firing a premature beat, or they are firing them across different pathways to create different morphology or shapes. So, this is a normal sinus rhythm with multifocal PVCs. I hope this helps. We covered normal sinus rhythms as well as events that can alter an EKG. Good luck with your studying and have a nice day.